So I thank you very much on behalf of the AIDS Society of India and People's Health Organization. This is a media briefing for the World AIDS Day 2022, and this is started from 1989, and this is almost 23rd, 24th now, World AIDS Day. This year's theme is energize, and energize means we would like to energize. No, what is this? Energizer. Uh, no, equalize. So basically, we would like to see that there is an equality in getting ART, not only ART, but kind of a advanced ART, and along with that, the tools and facilities for looking at viral load, CD4 count, good medical checkup, and see that everybody with HIV gets a full range of life as much as HIV negative people. It is also to see whether every part of the community is being given equal importance. It is also to see whether the marginalized communities, particularly MSM, sex workers, transgenders, injection drug users, jail inmates, they are being cared for. So what we see from what has been kind of knowledge for us for last 37 years is that initially we used to think that sex workers will have a highest prevalence. But in the current scenario, the prevalence of injection drug users is the highest, and then it is with the transgender, MSM, jail inmates, and then coming lower than that is female sex worker. So where we used to think that it should be highest, that has gone to lowest. It is just 4 times or 5 times more than the ANC clinics. ANC clinics currently 0.24%. So with this, that means the community work which has been done by several hundreds of NGOs and the central group like sex workers organizations, we are getting results. Without making further ado, I would like to introduce my panelists. Dr. Dilip Mathai is a Vice President and President-elect of AIDS Society of India. He is currently in Vellore. He was Dean of 2 medical colleges until recently, until last month. And now he's connected with only Nellore Medical College, which is of Apollo Institute. I have Dr. Glory Alexander. She is also Vice President of ASI, and she is a founder and trustee of Asha Foundation, which is one of the leading NGOs in Bangalore and South India. I have Dr. M. Kumaraswamy, who is a AIDS clinician with VHS Hospital in Chennai. He is in charge of or director of the Infectious Disease Institute there. He is also the Secretary General of AIDS Society of India. Later, will be also joined by Gopal Shetty and Jayashree Lengade or Jayashree Shetty. They have written a book called Blunting of an Epidemic. And that book is focusing on PHO's work for last several years. So with this, I would like to request Dilip, because Dilip has to go somewhere. So Dilip, can you share your views, and then you are free to leave after some time.
Oh, that's okay. Anyway, thank you so much. And it's quite startling statistics that we are seeing now, when we got to close the gap and make sure that we reach our targets by 2030. Today is 2022. That means I've got 8 more years in my career left to see whether I can move out of this world, saying goodbye to HIV. Let's see. I don't think it is possible. But why is it so? And Dr. Gilada in his statement has said that we have about less than 100 months left. Why is it so? And I'd like to just focus. It's not my specialty. Two things I wanted to say. One is about the 70,000 children with HIV. More so, why are we having only 70% or 65% coverage in the women or in the pregnant mothers to prevent the vertical transmission? I have no answer to that. The second part is why I do believe that once you've got your viral loads down, that I am not stating that the inflammatory process is completely subdued. The immunological process is subdued, but the inflammatory process is not completely subdued. There will be release of cytokines, and there may be an accelerated atherosclerosis. but at least there are drugs available to ensure the longevity of an HIV infected person today equal to an HIV uninfected person in the next 30, 40 years. So I'm not saying that the drug therapy will certainly minimize the deaths from HIV/AIDS. Today we are having about 40 or 50,000 deaths per year on HIV/AIDS, just being in adult medicine. So I just want to just put these two and together, and that is prevention of mother-to-child transmission, and how best can we get more people into the treatment arena. And I don't know what is preventing us from getting more people. I'll just like to conclude with these two, but I will listen to the remainder of the conversation, and as it moves along. Thank you.
Dr. Glory?
So, good afternoon, everyone. My primary area of interest actually is HIV in women, with a little more specificity on prevention of mother-to-child transmission of HIV. Today, if we look at the world, of the 38.4 million who are HIV positive or living with HIV globally today, about 54% of them are women and girls. So women and girls form a majority of those infected or living with HIV. And of these 38.4, about 1.7 million are children who are below the age of 15 years and who are living with HIV. If we look at India, why is it that when we look at children, 88% or almost 90% of children who are positive living with HIV in India have got that infection from their mothers during their mothers' pregnancies? So the reason for this 88 to 90% children being HIV positive is because the mothers are HIV positive and they did not have access to treatment at that time. And these children were born positive because the risk of transmission from a pregnant mother to her newborn child is around 45% in a breastfeeding population. So in India, according to UNAIDS, the risk of transmission today has reduced from 45% to 24.3%. But I feel that that is an exaggeration, and that we have been able to cover. Look at it this way. In India, about 27 million women get pregnant every year. And out of this 27 million women, there are about 20,000 women living with HIV hidden among this 27 million. And many of these women live in rural areas. So if we look at the year 2020, till about September of 2020, about 16 million pregnant women were actually tested out of the 27 million. And out of those who were detected to be positive, about 90% of them actually received ART. And about 85% of the babies born to these mothers received also prophylaxis for prevention of mother to child. And in that group, in that cohort, there were 254 babies who were found to be HIV positive. I think our biggest challenge is actually reaching out to 27 million women every year and getting them tested for HIV, because many of them live in remote areas and do not have access to medical care or even a hospital visit. So that could be one of the reasons why it's difficult. But the important thing to remember is that there are about 15, 16, 17 countries around the world who've been able to eliminate mother-to-child transmission of HIV. We are getting there. We are working very hard. In 6 states, EMTCT first phase is over, and 13 states phase 2 EMTCT is going on. So we hope that at some point in time, we will also be one of those countries who have eliminated mother-to-child transmission, because if we do that, then we are eliminating about 88% chance of children getting infected with HIV, or we are eliminating pediatric HIV. So the answer is actually to reach out to the most vulnerable groups and to be able to provide them with treatment so that we would be able to eliminate mother-to-child transmission. I must comment that a lot of effort is being made, but you must realize that over the last 2 years, when we've had COVID-19 pandemic, it actually displaced the HIV pandemic and occupied pride of place. And HIV population suffered a lot because of this. There was no access to treatment, there was no access to care, there was no access to testing. So all of this would have contributed towards the reason why we have not been able to achieve the targets. And we must also remember that the last 20% of achieving targets is actually in the most vulnerable of populations, and they are the most difficult to reach out to. So that's all I have to say. Thank you.
Dr. Kumar Swami, please.
Yeah, hi, good afternoon, everyone. My name is Dr. Kumar Swami. I'm an infectious disease physician. Primarily, my work is on to provide antiretroviral care, where we provide to very large number of people living with HIV in Chennai, where majority of our patients from entire southern India. So today, we do have a potent antiretroviral therapy for people living with HIV. And because of this, anyone who has got HIV, if they know their status, if they have access to this treatment, they live like a normal people. So today, we call this HIV disease as yet another chronic manageable disease like diabetes and hypertension. But again, this is only for persons who know their HIV status, and as well as they should be receiving the care. All these antiretroviral drugs, we have got a variety of drugs available. First line to start with, if they fail, second line, third line, there are a lot of newer drugs coming up. So these are all available even in lower and middle income countries, where majority of these medications are manufactured and prepared from India. Almost 90% of the antiretroviral medications for the whole world has been manufactured from India. So here the gap what we have is a testing. So I think this is time that we need to have an appropriate awareness among people who have got a risk behavior to go for testing and to seek appropriate antiretroviral treatment care because it is available. Now, research have shown, our group and others have shown, the life expectancy for people living with HIV is similar like people who do not have HIV if they receive the appropriate antiretroviral care. Again, having said that, I think today in 2022, if these antiretroviral drugs are not being provided for people who have got HIV, it's like a criminal offense. I don't know who is going to own this. I think we all should collectively make sure that people should get tested and linked to the treatment. It's not just on treatment alone. Today, people living with HIV, they live longer. And because of that, they get aged. They also develop a variety of non-communicable diseases. I think this is time to integrate people with HIV care into other specialties like diabetic care, cardiac care, bone care, and kidney care. This is something what people with HIV, when they're on antiretroviral drugs, on a long run need, which again is available in India. India is being a country of like Mecca of medicine. But on the other hand, still there are significant number of people who need this non-communicable diseases care or been discriminated by various specialties. It's time that everyone gets united to provide appropriate care. And today, a word about prevention. We don't have a vaccine for HIV. There are a lot of trials still ongoing. We don't have an effective vaccine. So, but we do have drugs which can prevent from someone getting infected. These are called pre-exposure prophylaxis, we call PrEP, which are available as an oral tablet. And also very recently, it's also been developed as a long-acting injectable, every 2 months having a shot for people who don't take this medication. I think this is time that where these remedies, either oral pills, all these injectable, long-acting injectable, are available to those risky population who don't have HIV to use so that they can use this so that they prevent HIV. So currently, there is no implementation program in India. It's been used only in the private care and by few NGO setting. I think this is time that our government program start implementing a large scale on this PrEP program. If we do all these, identify everyone with HIV, put them on antiretroviral treatment, make sure that they have a comfortable lifestyle. And also research shows if they receive antiretroviral treatment, if the viral load is undetectable, they will not transmit infection to others. This is what is called U is equal to U. Undetectable is equal to untransmissible. On combination of all these, if we can implement and unitedly do this, we'll be able to eradicate HIV one day from this universe. Again, thank you again for this opportunity.
Thank you, Kumar. You raised a very pertinent question about PrEP, pre-exposure prophylaxis. And smallest of the small countries in the world, and almost all countries in Africa, they have a PrEP in an official program. And they are using all the PrEP medicine coming from India. Second dichotomy is that PEP is allowed, but PrEP is not allowed. And most of the time, even PEP and PrEP drugs are the same. And thirdly, if there is some moral issue that why should we give some prophylaxis to people who are going to take risk? On the under the same note, the issue was also with condom. When we started condom promotion, they said, how can we distribute condom because people, those who are not taking risk, they will start taking risk. And lastly, if we are able to provide ART free of charge, even for those people who are, we haven't got HIV because of government's fault or anybody's fault, by their own behavior. If we are able to provide them condom free of charge, if we are able to provide them PEP, I don't think what is the logic of not providing PrEP. So I think we need to lobby around. Probably Government of India, National AIDS Control Organization, they are in a mood to listen to this issue. And if you look at even the budgetary involvement, it's a minuscule if you compare that with ART expenses. And lastly, if suppose you don't give PrEP and person get infected with HIV, then you provide them free ART. So that means we are asking people not to take precaution, get infected, and when you get infected, we'll provide you free treatment. So I think we need to look at this issue. Another issue I would like to you people to deliberate is HIV self-testing. Last 5 years or maybe 6 years, WHO has approved HIV self-testing. It has been practiced in a lot of even Asian countries, particularly Taiwan and Vietnam, for last 5 years. And HIV self-testing is available on Amazon. You can buy a kit, but it is not under program. So what would you like to say about this?
I think you raised an important point on the PrEP. It's science very clearly shows that they take it, it works. And also for people who have difficulty in taking this every day for adherence, now we have this long-acting injectable. I think this is time for, in a country like in India, where we are not able to contain HIV just by doing information, education, and by promoting condoms. I think when we started treating people, when their viral load gets suppressed, we are able to see this prevention effect globally and as well as in India, which all the data very clearly shows. Now with this excellent data on PrEP, and as said by Dr. Gilada, why it is not there. I think this is time that government should start very seriously how we can, because it's a very important tool, and also it's a tested tool and it's a scientific tool where we are not using. It's been available, to prevent, HIV. I think this is very important, and also this long-acting injectable where they have seen, it's been acceptability is extremely good in Western countries, and in a country like in India, I'm sure this can make wonders in preventing, this HIV. I think probably I'll leave this to self-testing to Dr. Glory.
Yeah, I think I would like to re-emphasize both what Dr. Gilada and what Dr. Kumaraswamy have been saying. If you look at HIV in India, we actually have two types of epidemics. One is the epidemic in the general population, where the seroprevalence is about 0.24%. But we also have key populations in India. And by key populations, we mean sex workers, men who have sex with men, transgender, injecting drug users, prisoners who are incarcerated in jails. And in this group, the seroprevalence is higher. It can vary from 1.9% among the sex workers to about 6 to 7% among injecting drug users. And these are the most vulnerable of all populations. And because of the stigma and discrimination that exists towards them, it's very difficult for them to be able to get themselves treated or cared for in a public area. So it's always, hidden. And this is one of the most difficult populations to reach. And that is why the theme for this year's World AIDS Day is equalize. We need to see that every individual, irrespective of where he belongs, to whom he belongs, whether, they should be able to access treatment and avail of all services equally. This is very important, and that is why we have the theme Equalize for this year's World AIDS Day, because the whole world now knows why it is that we are not able to achieve those targets of 90-90-90 or 95-95-95. It's because we are not able to reach out to populations that need it the most. The second thing that we need to remember is there is yet another tool that we have, in addition, of course, to ART in the form of PrEP as well as direct ART. But we also have self-testing, which we should encourage and which we should work on in India, because in self-testing, many of these key populations would be able to test themselves after receiving counseling, maybe through the telephone, and they can get themselves tested. And one study which was done by a particular group found that the incidence was rather high in this group who tended to self-test. So we are reaching out to a risk population by doing self-testing. And I think we need to be sure that self-testing can become one of the can be integrated into general care for people living with HIV, and that it would become accessible and that people could reach out and test themselves at home and then be able to reach out to healthcare professional for treatment. So self-testing is an extremely important tool that we have in addition to PrEP. PrEP also is something that can be used extremely widely, universally in the key populations. But these two things are not really happening right now. And we need to spread this news and be able to reach out to them so that they'll be able to use this widely and contribute to the decrease in to achieve the targets that we have set, that UNAIDS has set for the world. Thank you.
No, but but more importantly, what Dr. Glory is that give the world 3 ideas from this year. If I have to say this, I would say improve the coverage of pregnant women and minimize HIV transmission. You have already alluded to the fact that 10 to 15 countries have done it. Why can't we do it? And we are going to be in the top 5 in terms of economic, trajectories that they say in terms of trillion-dollar business. We have to ensure, and Dr. Kumaraswamy, you will still have 2.4 million people living with HIV, but it's not transmitting, because we will not be able to eliminate HIV from the world or eradicate HIV from the world. But we have to make sure that we don't create new people. You are having 7 new infections per day. No, why? Oh, sorry, 175 or 200 infections per day as such in India. How do we limit that? Now we are talking of, you got all the tools. Where are we failing? I really don't know where we are failing. Is it that we need more HIV physicians? Is it more that we tell the world that you've got preventable drugs, drugs that can be used to prevent transmission? Everybody knows about safe sex.
Please unmute. Dilip, you are muted. Please unmute yourself, Dilip. Dilip, you need to unmute. Dilip.
Yeah, and the third one is make sure that people know that these drugs are available.
So I think you brought some points on what's a lack in it. I think some of the things are not in individual hands. I think it's a policy. I think this is time that scientists, biologists, physicians, and affected community sit with the government, make appropriate policy, because these tools are available. And another important factor, which is because we have a lot of tools, one on testing, one on treatment, one on follow-up, people get different things and prep. It's all education of the appropriate stakeholders is very important. This is something AIDS Society of India constantly and continuously educating a very large number of healthcare workers across India through our annual AIDS Society of India conferences, and also partnering with many regional meetings, like with various other medical associations, where we create a session on AIDS Society of India so that we talk about the HIV disease pathogenesis, treatment, newer treatment, prevention tools, and various other diagnostic related complications and everything we discussed during this. I think this is something should be done very continuously, where ASA has taken up as a huge project and which we have been doing, across India.
There's a question being asked here that what Dr. Dilip Mathai said, that why we are getting so many infections still, despite all this thing. And I think we need to address upon those people who do not know their status, who are infected, because major transmission currently is happening not from those people who are on under treatment, because it is undetectable, is untransmittable, and Government of India's program shows that it is around 96% of them are virally suppressed, between 90 to 96%. So in
Yeah.
the third 95, we have achieved a great deal, but in the first 95, we are lagging. And that is the static figure. That figure is going a little bit up, but by that way, even the numbers are going up. So from 2.1 million, we have gone to 2.4 million. And from 1.4 million, we have gone to 1.7 million of the people who know their status. So I think
I think to, I think
self-testing
I,
and self-testing.
I think Ishar, you raised a question on why people are the question which was asked. People are still getting infected, and why new infections. So I think there are clear data available. These transmissions are happening from recently infected people. Somebody who's infected in the last 3 months, their viral load is very high. They do not know their HIV status because they do not have any symptoms, and they don't test, and either they don't want to test or they don't have access to testing, and their viral load is very high, and they'll transmit. I think if we fill that gap, that's a huge gap in India and many countries, we will not be able to prevent 100% HIV transmission in India. I think this is time that anyone who has got a risk factor, they should have access to testing, including self-testing, and immediately seek antiretroviral treatment. There are studies showing that someone who is recently infected, by taking antiretroviral treatment, even by 7 days, suppress the virus to an undetectable level, and there is a prevention effect starts. So I think this is a very important question, unanswered question, and why HIV still transmit is again from people who are not receiving treatment, who do not know their HIV status.
So any passing remarks you would like to make? Just 1 or 2 minutes each, starting with Dr. Dilip. Closing remarks.
No, I think we are on the right line. We have identified targets. I think it is mainly execution. Now, who should execute? I'm not holding the government to execute. It is up to each individual, each citizen of the country to execute. So it's very difficult to point fingers at others, but it is doable and it is really achievable in the time frame as such. Thank you.
Dr. Glory.
I would like to say that I think the theme equalize is very significant as this year's World AIDS theme. If you look at India, we know that out of the 2.4 million people who are positive, 77% know their HIV status. So we have a remaining 23% which does not know their status. And that is the group which is the most vulnerable. And they belong to the key populations. And that is the group that we have to reach out to. And that is possible only when they are able to come out freely and access treatment, care, and testing. Then we will definitely achieve the targets which are still pending. That is what I feel. I feel we have achieved much, but we should also achieve much more than what we're doing right now. And I still think it's all achievable. And I'm really hopeful that by 2030, we can proudly all of us sit here and say, yes, we have achieved it. HIV/AIDS is now no longer a major pandemic and we've been able to eliminate it. So I think we should look positively towards that. Thank you.
Kumar?
Yeah. We do have now excellent biomedical tools for treatment and as well as for prevention. And we have several combination effects shown by science. We all know that science is never defeated. I think if we all can use this tool appropriately as soon as possible, without much delay, I think we'll be able to get the quicker effect in this prevention and elimination of HIV.
Thank you very much. We had an excellent discussion. A couple of points which came, which we need to harp on. One is the first 95, where there is a huge gap of people not knowing their status. And I think we should work on this issue collectively, government, communities, especially those people who are more vulnerable. Secondly, harp on the starting PrEP, PrEP or PrEP program in the official program. Thirdly, HIV self-testing. And fourthly, there cannot be any better day than today to discuss that we have to all work in tandem with each other. Collectively, only we can defeat HIV. Though we keep a goal of eliminating HIV by 2030, we all know that it is not going to be possible. No STI or STD has gone away, despite having 100% cures like syphilis, gonorrhea, chancroid, zoonoviruses, LGB. They are 100% cures, but they have not gone. So they are ping pong infection. Pong is infected, infect the ping. You catch hold of ping, infect, treat the ping, they have infected another pong. That will go on. But our job is to see that those who are infected, they should know the status, and especially when the medicines are originating from India, benefiting the rest of the world, why it should not benefit our own people? So whether elimination of mother-to-child transmission, or providing PrEP, or providing having one of the best viral load controls, I think India should be leader in that. Rather than that, we are looking at a lot of African countries as leaders. Now, Botswana recently has been, in last 8-10 years, is leader in almost all the parameters of HIV control and HIV management. So I think we need to learn from African countries which are have-nots. They're totally basing their requirement on countries like India or funding from PEPFAR, and still they are able to achieve the goals. I don't know why we are not able to achieve the goal. Thank you very much, Naresh, for spending our time. Thank you. I thank the members of the media for making themselves available for this program. Thank you.
Thank you. Bye-bye.
Thank you.
Thank you. Bye-bye.